Hello, everybody. As we meet today, let me begin by sharing a story with you, a very personal story. I will be handing over a piece of my life to you today. Let me take you back 19 years, rewind back to the time. I had just fallen in love, gotten married, surprisingly got pregnant quite quickly, and we moved cities. All these former years, I was based in Kolkata. But when I was about 3 months pregnant, me and my husband moved cities to Mumbai. We had a lovely time discovering this wonderful Mumbai city. And then, see, around the 7th month, end of my 7th month of pregnancy, obviously I wanted to go back to my mom. So I went home, back to Kolkata. Now, the doctor who was treating me there was a very dear friend, a family friend. So we went, both of us, me and my husband, wanted to meet him and just discuss the way forward. We were having a fantastic time here, partying in Mumbai. So no stress. We never thought that something different or strange was happening. It was happy times for us. I still remember that meeting. It kind of changed my life. Across the table, the doctor just said that everything is perfect. So when do you think you want to have the baby? What date suits you fine? I was surprised. I'm like, I don't know. You tell me, what am I supposed to answer? He was like, listen, we will do this on a Tuesday. Tuesdays work better for me. Weekends are a little difficult. So it'll be a Tuesday. Why don't we, there was some discussion, and then he said, okay, fine, Tuesdays might be difficult for your husband to come over from Mumbai. Whole week, taking leave. Let's do this on a Thursday instead. It's like, okay, how on a Thursday? How does labor actually, can you really schedule it that way? It's like, no, listen, you have no idea what you're talking about. Labor, where does the word labor come over here? You want to have a baby. I am here. I will help you. We will simply do a very fine 4-inch cut. It's a Cesarean cut. We will be out. What are you expecting? Have you ever realized what pain is like? Have you ever felt you come from a loving family? This is what he was telling me. You have been showered with love. You have gone to good schools. You have no idea what pain is, what labor is. You want to see what that is? Come and see in the rural areas. I will take you when I go. The uncle figure, one scolding, and it's like, don't talk too much. Don't have an opinion, please. So, it was from there that the silencing started, I think. I was silenced. I was nudging my husband. Let's ask some more questions. There's so many things we want to know. So we he said, okay, fine, we'll do this. Wait. Proper time. Finally, we found a time. We asked him, doctor, like, we were very keen that let's just do it the way it's supposed to be. She's ready, I'm ready, we want to do this together. I want to be with her when she brings forward this life. We want to do this together. He was like, listen, there's no together in this. You are nowhere in the picture, your job is done. Now, yes, and now as far as your wife is concerned, do you all have any idea what you're asking for? What if the head is stuck? He showed us a diagram. A little taken aback we were, because let me take you back, if you remember 19 years back, I didn't have a mobile phone. None of us did at that time. Not so common. I did not even have an internet connection, where I could go and check out Baby Center and see a couple of diagrams. There was a book called Dr. Spock, I remember. I was, reading it voraciously, trying to find out, yes, how to breastfeed, how to do other things, but the diagram of the baby's head stuck. And I said that, so what, and what next? Brain damage, do you really want to risk that? Let's not get into this. Do it the way it's supposed to be. He just very nicely assured me, reassured me. I have gone abroad, studied this. This is my domain. I am the expert here. I'm the one in charge. Let's come back to the present. Who's supposed to be in charge while giving birth? I still wonder. Well, the woman is not supposed to be in charge, I suppose, according to the narrative that just kind of was going on. So anyways, at the age of 25, absolutely normal, healthy, happy pregnancy. I counted my days, we planned the date. I did try and kind of protest a little more. I had a bad habit of doing that too often. I went back home. Now this was a big family of 25 people. That's where I grew up, in one of those huge joint families, full of moms, aunts, grandmoms, telling us how it is. On the other hand, also full of very nice, sincere, particular patriarchs. Another round of silencing. Do you know better? Does your mom know better? Do you want to really say anything over here when the doctor says something else? I wanted to be a good girl. I went ahead. 18th of March, it was 17th. 18th was when she was born, yes, 1999. I still remember sitting in that room, wondering what's happening because I was not ill. Nothing was really wrong with me. Desperate, you know, I didn't know how to break that stress, the fear. So I did something. I took a bottle of nail polish. I remember almost the entire night I was applying nail polish, something to de-stress, because there was nobody else in that room. Finally, next morning, I did have my baby. I have no idea how that happened. It was under general anesthesia. And so it was a girl. It took me time to even hold her. 24 hours before I could feed her. The recovery, I can only say, was definitely not like the ones I had heard from Ma or my aunt or anybody else. It was a very different cycle of recovery. And life was also very different for us by then, you know, because already I knew that within a month I needed to be moving because I had to get back to Mumbai, take that train. I'm sure a lot of us here would have had very, very similar stories. Now, what do I tell you? I mean, I had no idea where this was going. Today, it just feels like a fragment of my past. I don't know why, but in the last so many years, I have consistently revisited those moments. Whether I wanted or I did not, something was taking me back. Every time, every milestone that my child was achieving, I was constantly thinking that, how did it all start? Yes, I was happy, and mind you, I was asked to be very happy. That's what new moms are supposed to be. So yes, I was very happy. But those memories also brought with it a feeling of tremendous disempowerment, the feeling of not being listened to, of being silenced, of being ignored, of not being asked. It was much later that I realized that a woman during birthing actually has a set of human rights. Human rights during childbirth is also very, very critical. We have a right to privacy. No one should question that when we are giving birth. We have a right to self-determination, a right to autonomy, bodily integrity. And we have the right, a very, very important right, to informed consent or refusal. there are two words here, informed and consent. Whether it is consent or refusal, I cannot give it, or neither of us can give it over here if there is no information available. But I learned about all this much later. Here in Mumbai, after planning many dinner menus, ironing clothes, doing a lot of other things that we normally do at home, I decided enough was enough. I needed to go out and see what is this whole thing that is bothering me. I used to work as a journalist, and then I took up a job in a lovely magazine where I was covering women's health, especially pregnancy and birth. And that opened a whole window for me into so much of discussion that was happening the world around. That is where I learned half the things that today I realize that is what is SRHR, sexual and reproductive health and rights. I knew I didn't know enough, just working, interviewing, trying to bring out women's stories. This was an amazing opportunity because I realized the power of a story, the power that women hold within themselves. Each one of us have a story within us, whatever it might be about. If we look back and rewind, we can definitely revisit it. And bringing them out, not just silencing them, listening to them, they can really change the world. I know it sounds a little strange perhaps now, but I'll just tell you how it happened with me. It was just a simple personal story that set the ball rolling. And from this job, just in my quest to know more, I enrolled for a full-time course, a master's degree in gender studies. I quit my job, I went into the classroom, wonderful sitting there once again, giving my exams, and learning whatever I could about theories. Where I read books that told me about how mothers were becoming like machines, how women were becoming like vessels, just carrying a life forward, where the dehumanization of this entire process was almost complete. Women like us were actually telling how they felt disconnected with the entire process of birth. They did not have anything to give or take from it. Finally, the last word was, you have a healthy baby, so you better be a happy mom. That is where the dilemma was. Birth was not supposed to be anyways like, it was supposed to be an empowering experience for us. So how did this all happen? How did we slowly just lose something that is so natural to us? Let us just see that why am I making such a hue and cry about something that might be totally natural, normalized in our everyday lives today. Every other day we hear of cesarean births. Why is it still troubling me? The World Health Organization very clearly gives us a guideline on cesareans, 10 to 15%. That is the ideal recommended rate that should be present in a population. This is what our states are faring like. Should I say more? I just thought I'll share the numbers of some of the cities. 98 in Chandigarh. That's the percentage of cesarean births taking place in private hospitals. I don't even know where to begin, where to end. Neither did I know this when working as a journalist and later on studying as a student in master's, enrolling for a PhD at this point of time, struggling with it. I met a group of women here in Bandra itself. This group was called Birth India. This was a group of women sitting in their living room. I found friends in them because that is what they were discussing exactly. The issue of respect, information, consent, when it came to women and our bodies. Our bodies have literally been a war zone, let me tell you, as far as policy is concerned. When it comes to pleasure or the privilege, everywhere. We have hardly been listened to. I was not willing to take this. I had a daughter who was growing up. Definitely did not want her to go through what I had. What you see here is a petition that I made after months and months of deliberation and studying, also hosting a conference at the Tata Institute of Social Sciences with various NGOs and with the support of Birth India. I was collaborating there, presenting there. I made this petition. Why do we, as consumers of a healthcare system, not have any information about the number of cesarean deliveries that a hospital or a practitioner is conducting? As consumers, we have every right to know that if we are availing of their services. I'm not even going into the ethics of whether a woman should know. Purely from the point of view of debating this out, I will say as a consumer, I have a right to know. As a patient, I have a right to know. Though I don't think pregnant women are patient, really. We are absolutely healthy people. What we are looking for is a little support and compassion, someone to hold our hands when we undergo labor and give birth. A normal, risk-free birth. And never, I want to clarify this, never have I said that cesareans are wrong and there should not be cesareans. Cesareans, by the way, are life-saving surgeries. They save lives. And that is what it should be. Not a 98% cesarean section birth. Are they trying to tell us that 98% women had high risk, they were supposed to lose their lives trying to give birth? Something that was meant to be so normal, like we eat and chew our food and eat. If someone told us you're at risk, you might just choke on it. Are we just going to stop chewing the food? Create a separate pipe so that the food can just be mashed and put in? It was not making any sense to me. So after discussing this, for trying to find the point, what is it that I wanted? I had no idea. I knew I wanted to change the system. I knew I wanted the system to respect women and their wishes, their bodies. But I did not know how to do this. What exactly was I trying to do? So through the World Health Organization papers, what I realized was one very small move, that is simply making public an internal audit, creating transparency in the hospital system, where clarity is given to the person coming in and asking for the service. That if you come in here, okay, in the last 3 months, these are the number of deliveries we conducted. This is the number of women, this is a high-risk facility or a low-risk facility, whether it's a tertiary care center, because we understand that if it is a tertiary care, a high-risk center, there will be more surgeries, because more complicated births will be coming there. It could be a referral hospital, but not each of us are going to referral hospitals. All we need is a local care center. And in that case, we definitely have a right to know what is this percentage. And the larger family, the community, just like the one sitting here, supported me. 3.5 lakh people up till now have signed on this petition. It's actually a little more than that. And I had the opportunity to meet the Women and Child Development Minister in Delhi last year. It started in the year 2017, January. I met with her, and it was wonderful to hear her side of the story, because she also had to share, what she underwent, what her daughter-in-law underwent, because it is something we connect as. As women, as families, we sit across, we talk about it. It's something we hold very personal, deep inside us, these experiences of our past. And she also told me what exactly she had underwent in her experience with the way, things were around her. And she agreed that this could probably be a game changer. However, such game changers are very difficult to achieve. There are many a hurdle on the way. One by one, we are crossing them. I asked the Maharashtra government specifically to look into it, because now it is my home state, and I'm very keen that we start from here. And I'm glad to tell you that there is a special joint commission that has been set up with doctors on mainly doctors, policymakers, and for the first time, women like me and you are there on that table, sharing experiences, telling what is it they want, what is it they found lacking in the system. That is the way, co-opting the care seeker, co-opting the women. That is how we can understand where we are going wrong in the quality of care that is being given. Where is it that I am feeling disrespected and silenced and dehumanized? Where is it that I'm seeking my empowerment? I'm not here to fight a battle unnecessarily. All I want to do is stop the unnecessarians that are taking place. The damage it's causing can be lifelong. There are huge risks, both to the mother and baby. This is out there. The research, the evidence is all out there. It's the only thing lacking, perhaps, are more questions. Questioning what has been normalized. We just take things sometimes too easily. We take them as a part of life, and as today's topic says, perhaps we don't rewind enough, we don't go back enough, look back, revisit. Thankfully, this is still making rounds. We are going from state to state. As another impact of the petition, I must tell you, a lot of women have come up to me. They have written to me, social media being this tremendous tool. On one hand, I'm questioning technology. On the other hand, I'm using the same to empower women like you and me. They're reaching out to me, writing to me, and I said that what is it that we can do together? So in the last 1.5 years, many things have happened. As my friend told over here, I was there at the United Nations General Assembly by event called Goalkeepers, where this issue came up. It was internationally discussed, and I guess it's not just a problem in our country. This is a worldwide problem. We are talking of something that is a huge impediment in achieving healthcare for all, in controlling the healthcare costs which are mounting every day. By addressing these issues, what will happen is we will definitely create not only empowered women, but the entire community will feel empowered. Reright is a foundation that was born. Reright, yes, rewrite. We want to rewrite and rewrite the reproductive rights that we have. We want to stand up for that too. The idea being that no woman should be unheard. Please hear our voices. So with the idea that no woman should be unheard, I thought that could be our way in redefining women's experiences, the way we live our everyday lives. Hopefully, more and more stories will come out. They are already. And we will be talking more about our sexual and reproductive rights, starting from a platform like this where young minds will know about it, talk about it, and be much better informed than I was when I reached a stage of my life when I had to make a decision. Whether to go take another opinion, seek another care provider, I really did not know. I wish I did. This was a very happy moment when Women's History Month this year decided to talk about the Cesarean section rates in the country and highlight the issue. The reason I'm bringing this to you today is I started my conversation with a story. And I want each of us to realize that these stories are hidden in our own lives, in our pasts. If we are willing to look back, these very memories can create, movements like this. Entire social change movements. We can question the norm. We can decide to break some very important rules that have been set up for us. It's important to question those rules and break them when the time is right. Before I wrap up today's little rendezvous with my past, I want to go back and tell you that the whole purpose of rewinding is perhaps rethinking and rewriting what we are in the present. I will also tell you a small couplet, a haiku that Tagore wrote. I know the one in Bangla, but I'll try and tell you the essence. So, it says that, I asked my destiny, my fate, what is it? As I'm trying to move forward, there are so many obstacles, and something, some force is constantly pushing me backwards. Why is it, destiny, that there is this force that is pushing me backward? What is this backward pressure? And destiny just told me one thing: stop. Just turn around and look, and then speak. I turned around, I looked at my past, and guess what? I realized that what I was thinking as a push towards back was all a wrong perception. It was my back, the past, that was pushing me forward. It is only when we rewind that our past will push us forward, help us to move forward. Thank you so much.